Good afternoon. I'm Pooja Shrestha, a student of Western Sydney University. This is my ID card, and today I'm going to talk about case study of Amara stage 3C breast cancer. In this case study, Amara has been diagnosed with stage 3C invasive ductal carcinoma, which is advanced stage of disease involving the metastasis to nearby lymph nodes and surrounding tissues. The pathophysiology of breast cancer is associated with genetic mutations that interferes with normal regulations of cells, leading to uncontrolled cell growth and tumor formation. In Amara's case, the presence of a BRCA1 mutation is particularly significant as this gene is important for the repair of damaged DNA. This gene mutation can lead to cancer because of increased genetic instability. The cancer most likely originated in the milk ducts or lobules of the breast and gradually spread to surrounding tissues. As the disease progressed, cancerous cells spread through lymphatic system to the axillary lymph nodes and diagnosed with stage 3C cancer. Lymphatic involvement plays an important role in the progression of disease and possible post-surgery complications. When lymph nodes are removed during a mastectomy surgery, it disrupts the normal lymphatic drainage, which leads to accumulation of protein-rich fluid in the tissues known as lymphoedema. Furthermore, anatomical changes to lymphatic system disrupts fluid exchange and increase edema and discomfort. Amara may be experiencing pins and needles in the axillary region because of discomfort from surgery or tumor metastasis. The development of breast cancer can be caused by several factors in Amara's case. The BRCA1 mutation is a main risk factor that significantly raises Amara's lifelong risks, even though she does not have any family history. Being female and getting older are two more factors that cannot be changed. Looking at Amara's lifestyle, being physically active may reduce the risks but could not eliminate the risks of breast cancer. Her symptoms such as painless lump and discharge from the nipple are commonly early signs of breast cancer. Pain experience can be varied among individuals. It can be addressed through both pharmacological and non-pharmacological approach with continuous pain evaluation. One priority nursing intervention for managing Amara's pain is administering and regular monitoring of prescribed analgesics following her right-sided modified radical mastectomy. Post-mastectomy patients can experience pins and needles around the axillary region, which may indicate neuropathic pain and nerve irritation. After surgical removal of axillary lymph nodes, there is a higher chance of muscle stiffness, decreased shoulder movement, and lymphoedema due to changes in lymphatic drainage pathways. To prevent her from muscle stiffness and decreased shoulder movement due to pain, opioid analgesia is commonly used for management of post-operative pain and after mastectomy. Nurses should administer analgesia as prescribed, monitor for effects, and provide education to patients regarding the possible side effects of medication. Patients usually experience post-operative pain, particularly when wound drains are present and lymph nodes are removed. An individual can have moderate to severe acute post-operative pain if left untreated may affect mobility, quality of life, mental health, and overall recovery. So in addition to improve comfort and enable early mobilization, effective pain management may reduce the chance of developing prolonged post-operative pain. So as well as an important non-pharmacological approach is to maintain correct positioning of surgical arm and encourage light arm exercise to minimize discomfort and promote wound healing. A gentle exercise after breast surgery can improve circulation, reduce pain and stiffness, and help in the process of healing. If pain is persistent, offering cold therapy can be considered as it helps to reduce swelling and post-operative pain. Also, by offering cushion under her arms to reduce swelling and pressure on the site. As breasts are the representation of motherhood and sexuality in women, nurses can provide emotional support to reduce anxiety and depression by providing education on breast reconstruction in future if applicable. Furthermore, emotional support and nursing care can assist to reduce anxiety and build confidence during her recovery. After Amara had a right-sided modified radical mastectomy, one most priority nursing intervention that nurses should do for Amara is to keep checking and taking care of the surgical wound and drains. The nurses should check the drains dressing regularly for any signs of bleeding, swelling, redness, infections, or unusual discharge, as well as monitor the amount and color of fluids from the surgical drains. It is very important to follow aseptic techniques when changing the dressings and taking care of drains to reduce the risks of infection and promote healing. As Amara has gone through a major surgery, this intervention is important as it may increase the risks of infection and delayed recovery. Furthermore, drain monitoring is important to prevent fluid accumulation such as seroma formation, which is common post-mastectomy. Early identification of infection allows immediate treatment, which improves the outcome of speed recovery. Another important nursing intervention is to prevent and monitoring any lymphoedema and neurovascular problem in the affected arm. As Amara has reported that she is feeling some pins and needles around the armpit of affected side, which may indicate nerve irritation or abnormal sensation caused by surgical removal of lymph node. Nurses should monitor the affected arm for symptoms such as swelling, pain, less mobility, and sensory disorder, as well as encourage light arm exercise and put arm in a comfortable position to improve drainage and movement. In addition, provide education on how to prevent infection injuries and avoid heavy lifting in the affected area. This intervention is important because removal of lymph nodes alters lymphatic system, which increases the risk of breast cancer related to lymphoedema. Furthermore, early prevention and management approaches can lower the risks of infection and improve physical function, which helps Amara return to her regular lifestyle. Before discharging from a right-sided radical mastectomy, Amara requires education on pain management, wound and drain care, emotional recovery, and lymphoedema prevention. As she is going home with two wound drains for 1 to 2 weeks, education must be provided to document drainage output, maintain wound care, and identify the signs of infections such as redness, swelling, and fever, or unusual discharge. Amara reported axillary pins and needles after the surgery, which is due to nerve discomfort and lymph node removal, so that it is important to provide information regarding sensory alterations and post-operative pain management. She should take her prescribed pain medication and report to doctor if her symptoms persistent or worsen, as unmanaged pain may delay her recovery and affect her quality of life. Amara is also at higher risk of getting lymphoedema after the removal and the involvement of axillary lymph nodes. It is important to teach her gentle shoulder exercise to improve her mobility, reduce stiffness, and for speed recovery. Counseling must be provided to avoid heavy lifting, protect the affected arm, monitor for swelling or tightness that may be the sign of lymphoedema. Amara needs a holistic care for physical and psychological recovery. To provide continuous supervision and education regarding her shoulder mobility, referrals can be done to physiotherapist and lymphedema specialist. Multidisciplinary team can work together to help with follow-up treatments, and managing symptoms. Furthermore, counseling service and breast cancer support programs may help Amara cope with her body image concerns, mental stress, and family responsibilities caused by her stage 3C invasive ductal carcinoma diagnosis and BRCA1 mutation. This is the reference I have used for my case study. Thank you.